All right, we're at 12:05. Let's get this party started. So, Cindy, we can maybe edit it from here to for the when we post it. But I want to just welcome everybody that is here, and for those of you who are not here live, we're going to be this will be obviously recorded, and we should make information available as we can. So I'm Anne Rimoin. I'm the director of the Center for Global and Immigrant Health here at the UCLA Fielding School of Public Health. And I'm here with our team, including Dr. Macinko, who's also the deputy director of the Center for Global and Immigrant Health. And we wanted to today provide some information, long-awaited information on the Global Health Certificate, and to make sure that everybody understands that the Global Health Certificate, even in the time of COVID, is still being offered, will continue to be offered, and just make sure that everybody has the information needed to continue to pursue it. We're all very aware that COVID has been very confusing for everybody in terms of global health. And there are a lot of discussions to be had about what global health is going to look like going forward. But this certificate has been something that has been offered for quite a while now. We anticipate continuing it, in the future, and are going to provide all opportunities possible and flexibility for students who've already been through, halfway through this program. We've gotten a lot of questions about what you can do. The short answer is, of course, you can get a global health certificate even during COVID, and we know we do not expect you to have to travel overseas to be able to get this certificate. So with that in mind, we're just going to go through a little bit of an introduction about the Global Health Certificate, and then we can answer questions. This first slide about what is global health, I think that this comes back to what the fundamental goals of our center are, and what we want to be able to do here. Obviously, global health is interdisciplinary, and we're trying to tackle problems that transcend national borders. I think in the past we used to think about global health as something that was all over there and not over here, and we over here had to go over there to be able to do something related to global health, but that is absolutely not the case. I think that we are really trying to redefine what global health is, and that what we're thinking of is how we can ensure that there is an equal distribution of health, and health infrastructure, access to healthcare, and as the discussion has evolved over time, really a discussion of health equity and what that looks like globally. And I think that the COVID-19 pandemic has really unveiled the very serious inequities, not only nationally but globally, that we face in terms of access to adequate health care, and for public health policies that actually are useful. I think that when we think about what we're going to be doing in the future and how we want to be able to manage global health, what we want to be able to do is foster an understanding of what is happening, not only nationally or locally, nationally, but globally, and how we can really make sure that we're working together in multiple places. I think that the other thing that we've often, in the old days when we talked about global health, really we were talking about work only in low resource settings, whereas now I think we really understand the interconnectedness and the importance of working in all settings, and really figuring out how to improve communication and collaboration globally. I think we can just go to the next slide. So the Center for Global and Immigrant Health was established in 2008. And this center is something that is a resource not only to the School of Public Health, but to all the health sciences and to the entire university. We have faculty that have active research collaborations in more than 50 countries globally. Also people working with immigrant communities in California and nationally. And the real main purpose of this center is to organize this global health certificate. Our secondary goal is, of course, to promote global health work at the school and across the university, to foster collaborations and opportunities as well. We do have a listserv, which everybody can sign up for. The listserv is email is on the slide. And we also do send out announcements about global health, job announcements, and try to help facilitate global health internships as well, by making sure that when we see opportunities or know of opportunities, we share them with all of you. So I'm going to just go through quickly what the Global Health Certificate is and what we need to, what is required. Okay, here we go. This certificate is awarded through this center, the Center for Global and Immigrant Health, for the Fielding School. And what we want to make sure that we're doing here is to provide a broad base of knowledge within global health, and that we can promote cross-cultural understanding of how global health issues integrate into local health outcomes, social behaviors, policies, and practices. We also want to ensure that people have the opportunity to gain skills that are going to be important for global health work going forward. So the eligibility, you need to be a full-time enrolled graduate student at UCLA, but you don't need to be a student in the School of Public Health. So this is for any graduate students. You need to have good academic standing and then complete the requirements during or before your last registered quarter at UCLA. After that, if you've met all of the requirements, then at the end, we will issue you a certificate. It's important. A lot of people ask, will this certificate actually be on my transcript? And the answer is no, this certificate is not something that actually sits on a transcript. There are rules about that within the university. And so, but we will provide you with a certificate that can be used as documentation. So the requirements are pretty straightforward here, and we have them on our website. They're updated regularly. So you can always go back to the website should you need to reference it. What we require is 16 units of global health coursework. So you need 1 core course and 12 units of electives. We have a pre-approved list of electives, which is on the CGIH website. And if, in particular, in this time of COVID, if there's a course that you think might fit, that you can petition for an elective requirement, get it changed. So, you just need to submit that to us and we'll be able to review it. It's, we are really, we do understand in this time of COVID that it is complicated, that everybody can't get in all the classes they need, that there have been a lot of changes in class timing, availability. And so we do try to work very closely with you and to be able to accommodate when possible so that you're meeting the requirements, but there's some flexibility there. A key component of the CGIH of the certificate program has been field work in global health for at least 10 weeks and having a paper at the end that really summarizes your experience and brings what you've done, synthesizes what you've done in a way that's really understandable to us. Now, for COVID-19, for this year, for last year and this year, this requirement has been modified. And I believe we'll hit exactly what that's spelled out on one of the subsequent slides here. But the bottom line is, we want to make sure that, or actually, I'm not sure, Cindy, I don't see the actual how we've spelled out what the requirements are, like how we actually define a global health experience. Do you have the wording for that? Because I think we thought very carefully about this.
Adva actually has the form that we're going to use to be able to assure students that their selected internship will count. So Adva, do you want to just do that now then?
Yep, sure, I'm happy to.
Thank you. Let me stop sharing my screen so you can share yours.
Okay, great.
Because I think that's like an important thing to go over right up front, because it's the big question everybody's going to have.
Yeah, exactly. So this is this will be uploaded to the website. Everyone will be able to access this form that we ask that you fill out prospectively before you start your internship. And that way we can work with you to ensure that your plans for your internship will count towards the certificate, and you don't have to have any questions in your mind about its eligibility and all of that. So really this form is meant to help you go through all of those requirements, provide us with information about who you're planning on working with, when, and on what projects. And that way we can best support you. So you'll see here that first we just need your email address and your name, department, very standard stuff, when you are expecting to graduate, so we can keep track of all of your CGIH certification credentials. And then of course we want to know some specifics about the internship. When are you planning on performing the internship? With whom? We want to know where that organization is based, and we'd really love for you to be able to provide us with a contact name, someone at the organization who you plan to be working with directly. That's to help you along as well with planning your internship activities. And then you'll notice here, so we've got location of the organization itself, but then separately, where will you be stationed? That can be domestically, something local, it can be virtual, it can be international. That probably will not happen this year, but for people who are trying to plan far in advance, we've given you that option as well. So, and I know potentially we've got international students who might be going home for the summer break and might actually be working internationally. So that option is still there for those of you who may be interested in that. We're going to ask you to give a very brief description of the projects or proposed work that you plan on doing in this internship, and to give us a sense of how many total hours over the course of the 10 weeks required you plan to be working in the summer. And then just some really basic stuff here. We want to have a sense of what populations you'll be working with, what type of research methods you might be using. And then we've given this list of what we call global local competencies and skills or activities that you might engage in over the course of your internship. And that again is just meant to be, it's not something that has to be stuck to 100%. We totally understand that plans and projects will likely change as you work with the organization over the course of the summer, or whatever, whichever quarter you happen to be working with them. But we wanted to set it out so that you can work with your internship contact person to plan out what kinds of competencies and global health skills you plan to engage in over the course of your internship. And then you can always throw in any other comments or questions here. You can also always email us at the CGIH listserv, not the listserv, the contact email address that's on the website as well. So anyway, that's the form you'll be filling out, and that's essentially a sense of what kinds of information we'll be asking you about your proposed internship.
And I think that the key here, thank you, Adva, that's extremely helpful. And I think that as Cindy's putting back up the presentation, I think that the big question is what constitutes a global health internship right now and what that's going to look like. And, we really just feel that, we want you to have an experience that has some aspect of global health and the values and the skill sets associated with global health work. So and going forward. And so I think that, Cindy, we had worked on some language, in fact, some competencies associated with this, and we'll be putting them up on the website. Unfortunately, they're not here directly, but I think that that's really important, just to know that we're going to be very flexible and we're going to work with you. If you want to do, we completely understand that internships are very unlikely to be international this year. It's still too uncertain. It's not something you can plan on. So working with organizations that have a global kind of purview, doing this work remotely is perfectly fine for us. And even working with local organizations, working with immigrant populations, working with any group that has a real global outlook, and any project that could be construed as global will be perfectly fine in terms of how we're going to manage. So if you have a question, you want to figure out what it is that you're going to do, we're here to work through this with you. So that's the big piece of the field work that I think everybody has been really wondering about, and what does it look like? What does it mean? The next thing is the completion of the city training. And so we want to make sure that you have human subjects training, and that so you'll need to submit this as well. This will be on, also, we'll have the link to this on the website as well. And then, we want people to attend 2 global health seminars. These seminars are, also seminars. You obviously are not going to be physically going to a seminar, so it's perfectly okay. What we'll be anticipating is that you will attend by Zoom or whatever you can 2 seminars. You need to send us documentation of what the seminar is, and then maybe a screenshot or some way to document that you were actually in attendance at this seminar. If you have questions about if a seminar counts, feel free to email us as well. We'll be happy to be sure that it, to assure you that it does. But again, we really, expect you to use your best judgment. And I think we understand that everybody is trying to fit things in. But the good news is there's so many seminars that are now webcasts, that are online. I think the choices are bigger and better every single day in terms of this. So there's so many things to choose from. Then the last thing is this capstone, the capstone paper. And what that actually looks like. The requirements for that capstone paper will also be online. So let's see, I guess the next thing here, the next slide, Cindy, just to go over quickly what the city, okay, all right, great, here we go. Wait, where are we? I feel like the one that I have is a little bit different. Okay, well, I guess we'll go back to the
oh yeah, sorry, Annie, we updated it slightly once we sent it to James, and he
that's okay, so it's totally fine. I can roll with it, it's not a problem. So I think it's really important to remember. Okay, so we'll go through the coursework. It's no, yeah, because I'm looking on my computer. I'm like, wait a minute, that's not the order I have things in. But it's fine. Okay, so here's the coursework that's required. So we have CHS 200, HPM 240, or EPI 420. EPI 420 is Field Trials of Health Interventions in Low Resource Settings. That's my course that's going to be taught in this spring. It used to be taught in the winter, but now it's taught in the spring. It's going to be on Tuesdays from 4 to 6:50 p.m. There's room in the class. You know, it's if the requirements for this class are very flexible. So if you don't meet the requirements that are listed, you can always email me. You know, it's really going to be a very useful and interesting class, in particular this year, because field trials are so important in terms of understanding vaccine efficacy, understanding therapeutics, understanding so much as it relates to COVID-19. We're going to be having speakers who are working on field trials of Ebola, COVID-19, and other things as well. So I think that it's a very unique year for this course. And so if you're, you know, there's still room in the class, so please do sign up if you're interested. You also need 12 additional units, or approximately 3 courses of global health related classes. We do understand, we have a list here. We do understand that courses are a little bit different this year. People are still trying to kind of sort things out. So if you have a question, if you want to talk to us about substituting something, please do let us know. We'll be happy to discuss with you. James, you look like you might want to say something about the courses. I can see you.
Hi. Yeah. No. Just to add in that these courses do change. Please reach out to us. There may be courses in the School of Public Health or elsewhere that fit these requirements. You know, so although we want to make sure you have a good, well-rounded experience, there are other opportunities, but don't just assume that whatever you choose is going to be okay. Please just run it by us quickly ahead of time. And with that, I would also mention there's a question in the chat about the checklist online. So we talked about the different requirements. Jacqueline, could you let us know what your question is? Maybe we can just handle that now.
Yeah, online on the checklist, there's like 2 writing portions of 5-page papers, and it doesn't correlate with what you had on the previous slide, the wording at least. One says like analytic essay, and the other one, I think it talks about the field work, but I just want to confirm that that is referring to the capstone.
So are there 2 required essays or 1 required essay? Well, there's only 1 required essay, but I think what you're saying is on the online checklist, maybe as we updated it, there's an additional field there where there's 2 essays that it looks like there's 2 essays required. So that's definitely something that we're going to have to clean up, but definitely it's only 1 required essay, and it really is about your capstone experience and how it impacted your understanding of global health and your work in the future.
And then Dr. Macinko, I'll just chime in there to clarify, and I apologize if the language isn't clear. So there are 2 writing requirements. One is the 5-page capstone essay, which is more of like a reflective essay about your experience working on the global health certificate. And then the other one is we do need some kind of writing element from your field work. So those are 2 different pieces. I think we'll talk about it a little bit more, but and I apologize if it seemed like it was 2 essays, because it kind of is, but I'll try to clean up the language on the website. But there are those 2 writing components.
I see, that's right. Although for the internship, this is not a unique thing. It's the report that you would normally have to do for Public Health 400, which is the internship formal course. So for any MPH student, you're already going to be doing this additional, this requirement of your internship, which is this capstone or internship essay that you're going to have to do anyway. You just send us a copy of that, because that way we can document that you actually did that activity, right? Whereas the reflection essay is a way we want you to think about and integrate your experience with your coursework and also with your future career plans. Did I get that right this time?
It was perfect.
Yeah, that's 100% right. And because of that, I think Masters of Science students, non-MPH students, actually do have to do a second writing component that touches on the actual research or project they were working on in their internship. But that is on a future slide, I believe. So we'll get there.
There's one other question from Nikki about PhD students. And she asks, if we're a master's student transferring to a PhD program, would it be possible to do the coursework in the master's and field work when in the PhD?
Yeah, I don't see any reason why not. There's no time limit. to do this certificate. You can do it with a master's degree or a PhD, you know, in the master's or PhD program. Your only requirement is to be a graduate student.
I think the only constraint you might have is making sure that you do adequate field work, right? That you're really going to have the time to do that field work in the PhD program. You know, programs are a little bit different. It may depend on your requirements. It's really geared exactly towards the requirements of the MPH students. And I would say the majority of the students, although we've still had students from nursing and a few other fields who've been able to do the full certificate. Sometimes PhD students participate in other ways. They'll take courses. They might actually work on some of the global health projects, maybe more of a research-oriented project, but they may not necessarily go for the full certificate, but they can still have a very, I think, rich and full experience. And I know some of you have that experience. So,
and we're willing to work with you. We're willing to work with you on this. So if you're a PhD student or you're transferring into the doctoral program and you want to discuss what this would look like, you know, and what the field, you know, we'll be willing to work with you and come up with a solution. So, okay, other questions related to our, is there anything else in here in the chat? I think we're.
I had a quick question. So I was looking at the course list and there's a course, it's the public health at the US-Mexico border, and it's listed for 2 units, even though it's 4 units. Is it like a typo or?
I believe it used to be 2. Oh, sorry. Go ahead, Dr. Macinko.
No, exactly. Yeah, I think it may have been 2 when it was first offered. And sometimes if it's like a pilot class, like the first time it's taught, and then if it's taught and it's really interesting, then we put it on the website, and then it maybe gets a formal course number. Generally, if it has formal course number, there'd generally be 4 credits. But sometimes when they're experimental courses, that's 2 to 4 credits. So that might be the discrepancy. In any case, always obtain the syllabus. Like, ask the professor directly, let them know you're interested, try to get the syllabus. And if you have questions, you can certainly send that to one of us and we can take a look, to help you as well.
Okay, great. Thank you.
Perfect. Okay. So let's see. Oh, I guess so for field work, just one of these, we as we said, that so it must be completed while you're enrolled as a grad student, very important. 10 weeks or longer. So this is what corresponds directly to the MPH requirement here. So there's nothing more than what an MPH requirement is. And something that an approved internship or research topic. So again, talk to us about what it is that you're planning on doing. And so if you submit it to us, we will then be able to go over it with you and make sure that it actually does fit. Important to do this before you start. And then we have this paper. In terms of funding, I believe that we're still, obviously this year we're not sending students overseas, so it's a little bit different, but there will be funding opportunities through the school to support students in their internships, and that will be coming out of the public health practice group, right? James, do you want to say something?
Yes, thank you. Indeed, last year there was funding for students for all the internships, if they were non-paid internships. And so they expect, at least this is what the dean's office has told us, is that they expect there to be some funding available this year as well. We don't exactly know how much. We don't exactly know for what it will go for. Some of these are very specific, international nutrition versus reproductive health. But that's a process that really is decided when you apply for this. There's a whole committee that meets to try to make sure that there's an equitable allocation of those resources to meet students' needs. I would mention one other thing about the idea of approval. Now, the approval that you get from an internship from one of us is merely that it would count as being global in nature, right? It's so important that most of the process you do with your department's field studies coordinator. That person has often a list already of existing opportunities. That person can work with you to figure out how to develop an appropriate scope of work for your internship so that it meets the competencies required by the accrediting body of the MPH program. And that person will also help you to really figure out what can you tackle in this 10-week period. So for our part of the approval process, it's really, does this count as a global oriented thing? If you're already working with a global health organization, with an organization working in, that's based in another country somewhere, 9 times out of 10, it's going to be pretty easy to make that determination. I think where you might need some, I don't know, some conversations, right, would be, let's say you locate an organization working here locally in Los Angeles, working maybe with refugee populations, and you want to know, hey, would this count? And in that case, for their certificate, right? And in that case, we'd be happy to sort of chat with you about, not only does it count, but what might be some ways that you can make it more global in nature, right? Could you add some additional pieces to it? And I think that's kind of the help that we can provide. But please do not bypass your department's field studies coordinator, because that person is going to be the most important person probably to you in this whole process.
That's exactly right. Very important. So any other questions about the field work?
Yes, I actually have a quick question. So I am from the Department of Integrative Biology and Physiology. So how would I go about having a field studies department coordinator for my project per se?
So that's an interesting question. And, I think so do you have any field studies requirement for your master's degree? Any practical experience?
My project is it's a research intensive master's, but it's in the topic is under like physiology. It's not anything public health related.
And so you would need to have some sort of a global health experience, virtually or otherwise, that meets the requirements, the minimum requirements that we have in place. So, you would kind of be more like somebody who's a doctoral student or an MS that doesn't have the same kind of practicum requirements. So you would follow the same kind of guidelines of finding some sort of experience that would be, exactly along these lines. And so that's why it's going to be important too in this scenario, to make sure that you work with us to make sure that whatever it is that you're proposing to do actually fits the requirements that we have.
Okay, thank you so much.
I would also mention that if you're not in the School of Public Health, then the funding we talked about is probably not available to you. And I'm sorry, unfortunately, that's sort of just the way it works. That being said, particularly if it's going to be focusing on a research project, sometimes what students do is they do try to piggyback on a research project happening in a low income setting, for example, that one of their advisors or someone they've taken a course with is already working on. So that might be a nice opportunity. And sometimes you get lucky and they have a little bit of funding that can help you too. So, that might be one place to start.
And there are other funding options that are available that everybody should be looking into in general. It doesn't funding, while we have funding for our students here in the School of Public Health, there is the International Institute, African Studies, Latin American Studies, Asian Studies. I mean, there are so many different places to be looking for funding, both as it relates to UCLA, the graduate, what is it, the GRM, it's the GS, I always say this wrong, Cindy, GSRM, GRS.
The GSRM, the Graduate Summer Research Mentorship, something like that.
Right.
I was going to mention that as well. There are definitely grad division level funding opportunities that would apply to all grad students. Some that are specifically targeted at summer research and summer programmatic work, like the GSRM. So I would absolutely look into that as well, because you should absolutely be eligible for that as a graduate student at UCLA, regardless of what department and school you're in.
Right. And I think just to go back to this, you know, that our MPH students are required over the summer to have a summer internship that is this, you know, for a total of, 10 weeks, total of at least 400 hours. I would pay it, you know, for people that aren't necessarily going to fit into the same paradigm. It doesn't necessarily have to be a summer internship. I would pay attention to the hours, because I think that the number of hours, you know, it could be spread out over the academic year because you're working in addition on a project, a graduate project that is, you know, working globally or working on these global health issues, and that we can, you know, so you know, just think about that in terms of what the overall requirement is, and that we'll work with you to, you know, make sure that it all fits. But it's I think the 400 hours that you should pay attention to in that scenario, and true for PhD students as well, or MS students that aren't going to do a summer internship.
Yeah, that's a great point. And just a reminder that at the bottom of that prospective internship form, there's a section for comments and questions. You can always add those if you have comments or questions about a specific opportunity you're looking into. And otherwise, if it's more broad or earlier in your search, you can just email us directly and start a conversation, as James was mentioning earlier.
So yes, exactly. Okay, so a few other key points here. The city completion. So, you know, it does depend upon where you sit, but there's the biomedical researchers and staff and the social and behavior researchers and staff. They're two different ones that you can take. So whichever is more relevant to you, you know, in epidemiology, we do the biomedical researchers and staff generally. But, you know, I think it'll depend upon the project that you're doing, and you can always also ask us if you're not sure, but probably more likely than not, you should talk to your preceptor, and if you're an MPH student, talk to your, the coordinator as well. And make sure you're taking the right one, because you may have requirements in your department to take this as well. If you've already taken it for another course, you may also submit that. So you may have already taken this, which is great. You don't have to do it again. So once is enough. So for the global health seminars, you know, we advertise when we see something that looks interesting. We do advertise them and on the website, and the center is sponsoring these COVID conversations. We've already had two, one with Devora Davy, who is in South Africa, and Kalika Konda, who is in Peru. We're going to have another one on March 2nd with Nicole Hoff, who's in the Democratic Republic of the Congo, and she's going to talk about COVID in DRC, what it's like to be living there, working in the context of COVID, the impact on students, and the impact on research, the impact on program. Hopefully with Dr. Macinko and his contacts, we'll have somebody do one from Brazil coming in the near future as well. We're trying to hold these every month or so, and we'll make sure to let you know, but they are not the only options that you have. However, if you do attend one of these, please do let us know so that we can make sure we have the documentation for it. It's a pretty good and easy way to do this. So there are events all over campus, and not only just at UCLA, but at institutions globally. And it's, you know, honestly, 2 is just the bare minimum. If you're interested in global health, take advantage of the fact that there is so much content right now. There's a lot to be learning and a lot to be thinking about. Just remember to fill out, there's a CGIH lecture form. It's downloadable from the website, and attach either a screenshot of the webinar or a copy of their event registration for us if you can. And here is Dr. Hoff's COVID conversation. Will be on March 2nd, 12 to 1. I encourage everybody to attend. I think it's going to be really, really interesting. So the next question is about this professional reflection essay and what it looks like. This is, as we discussed, it's in addition to whatever your requirement is for your 400 project. And really what we want is a reflection of your experience and how it relates to global health, how it relates to global health competencies, what it meant to you, and incorporate this into your professional goals and career, your career goals. I think that's going to be very important. And we will have a one sheet on the CGIH website that we can also, that will also link, it'll be online, so that you have the very specific information on it. We're not going to grade you. We don't give you a grade. This is you know, a requirement to be able to get the certificate, but we really do read them and we really do appreciate them. And, you know, I think it would be really great, frankly, this is just an off note, I would love to be able to feature them, you know, on our website, because I think that the work and the reflection is so valuable and important in terms of how we learn about global health and how students are able to showcase their experiences. So we do appreciate that you take this seriously, that you take the time to think about it and use it as an exercise that really can help people in the future really understand the importance of the experience that you've had and inspire them to do the same.
I would also add that we often do have students present in panels. And so this is something we found super helpful, and other students really seem to enjoy it, which is, you know, after, we didn't do as much this year because, you know, what are people going to say? Well, I was in front of Zoom most of the time. And although the work might be very interesting and can also be very important, it's a little less compelling to kind of tell that story, you know, to other students. But each year we generally do have a panel of students who've gone and done these global internships, and that's usually really well attended, you know. And if you do end up doing an internship this year, we really hope to be able to call on you next year, you know, to be able to ask you to share some of your experiences, things that went great, things that were a challenge, kind of what your main takeaway is from that experience. Yep,
exactly. Exactly. I'm actually very excited to see these essays. I just think that they're really valuable, and they should also help you going forward, because you want to be able to articulate, if you're going to go into global health, if you're interested in global health, I think being able to articulate issues related to global health are going to be so important, and to be able to have this kind of reflection, you know, this should be, I mean, we all know that everybody writing any essay is work, but I think that it's a really important opportunity, and something that you might even be able to share as part of your, you know, a writing sample, for example, when you're applying for jobs and people are looking for writing samples. I would take extra care with something like this, because you do have a lot of latitude. And it could, in fact, you know, serve you very well for looking for a job. And here, just some more pieces here. You know, thinking about ways that you can work on this. So I think in general, you know, I think that the takeaway here is just to be very, very thoughtful about what you're planning, you know, to get some lead time here, make sure that you have time to talk to us about it, and to ensure that you know, you're on the right track for whatever it is. We're here to help. We really want to see you get the global health certificate. We think that this is a very valuable, important thing to have, and we're you know, we're excited to see it continue through COVID and beyond. We do have a Facebook page, we have a Twitter page, we also have, Cindy, I think we have an Instagram account too. We, you know, we're going to be trying to ramp up some social media content going forward. And so if you have photos of things that you've done or other, you know, interesting things you'd like to see us be posting, please let us know. Please do reach out. Any questions? Additional questions? I'm kind of looking over here at the chat. Yep, city, if you've already done it, that's fine. We've got the funding over here. How you can sign up for the city if you haven't done it. You know, if you do this, it's a great thing to get out of the way, because it's probably going to be required for a course and part of your ethics training. So it's really great thing to be able to do. And I think that that's a thing with this internship, or with the global health certificate, that having something, I mean, you know, a lot of these things are already required, so it's not a heavy lift for you, but it's really then being able to take global health, be able to synthesize it and kind of pull together your experience at UCLA and get credit for it. Questions? Doesn't sound like there are any more questions. Am I missing anything?
I don't think so. I also sent a link in the chat to a page on our website that has all of our certificate forms, and that does include a link to the competencies for global health as well. So I just wanted to note that. But again, you know, feel free to ask us questions after this meeting is over. We're happy to field any questions you have and work with you to ensure that you've got a great experience and meet the requirements. So just shout out to us if you need to.
Great, thank you, everyone.
Yeah, thanks to everybody. We really appreciate your time. We're looking forward to working with you all, and just do not hesitate to reach out if you have any questions.